my name is James Grellier. I'll just put a picture of myself up on the screen here. I manage the BlueHealth project. That's me. I'm an environmental epidemiologist, but today I'm lucky enough to be talking with Matthias Braubach from the WHO's European Centre for Environment and Health, who together with his colleagues at the Euro-Mediterranean Centre for Climate Change has been putting together a really useful tool, a decision support tool, which is a kind of key output from the BlueHealth project. So hi Matthias. I would really like if you could just explain to us what this tool is, who it's for, and how it's used.
Thank you, James. The decision support tool has been developed within the BlueHealth project as part of a suite of tools. They are largely looking into the environmental conditions and assessment of behaviors in and around blue spaces. But the decision support tool is looking into the health impacts and the health benefits related to blue spaces. So the idea is that the decision support tool will support, by adequate information, local managers and decision makers working on blue spaces within a city and on a local level by pulling together information on the impacts and the relevance of blue spaces for urban citizens. We will try to provide evidence-based information for the decision-making at the local authority level. The tool is targeting basically local practitioners on urban planning, management, environmental and health divisions. And it is cutting the evidence into three different categories. First, we are looking at information on the health risks of blue spaces and how they could be prevented. And secondly, we're looking at the benefits of blue spaces for population health. And this is, on the one hand, done through promoting benefits to human health. And what are the benefits of having blue spaces for socializing, for physical activity and recreation. And we're also looking at the benefits in terms of environmental dimensions and ecosystem services, because these blue spaces, of course, are an important part of nature. They have human benefits, but they also mean a lot to biodiversity and ecosystems.
Sure. Okay. Thanks very much. And this has been really developed to be used by lots of different kinds of decision makers and even researchers. And I think it would probably be pretty useful to imagine that I was one of those and I wanted to use this. And I guess it would be nice if we could just kind of walk through each of the steps. So I can see here I've got instructions on how to use it. Perhaps rather than just reading through that, we can make a start. I can see that there's a kind of path down here, so I can click onto the next page. Shall I click through?
Yes, please do. And you will always be able, with the arrows at the bottom, to jump to the next step or to go back if you want to make changes in the decisions, or you have to read more information.
Okay, great. So select your blue space. So I have to select the kind of blue space that I'm interested in, and that will determine the guidance and the priority risks and benefits that the tool will provide for me. Now, I live on the coast, so I'm going to go for marine coast. I guess if I click on another one, yeah, it changes here. So that tells us about rivers, we have lakes, urban fronts. So that means developments in very urbanized areas. And blue in green, what's this? This is parks, so things like lakes and ponds and so on. And then we have ornamental, which are these kind of water features such as fountains or water play parks and so on. Okay, well, let's stick with marine for the time being. And then I see that I have to describe my blue space. So what do I have to do here?
Yeah, we have in this second step of the decision support tool, we ask the user to select the blue space and how it is used. Because depending on what type of blue space and what type of use, and also what type of interventions are being done, there might be a local authority that wants to create a new blue space, or you modify the use or the shape of an existing blue space. And all these three choices, the type of blue space, its use, and what you're going to change or intervene on in the blue space, has an impact on the health risks and the environmental and the health benefits. So just to give one example, If there is swimming and water sports allowed in a blue space, you of course have a huge risk of flooding. You have contact with water, you have potentially ingestion of water, and then brings up completely different risks and to some extent a different set of benefits as well than a blue space that is simply used for onshore activities where people walk around the blue space and you have a more of a visual and recreational exposure, but not inside the water. And then of course also if you have a river with flowing water versus a lake with standing water, it also does a difference to the environmental performance, and associated with that, a difference to the potential risks and benefits of the blue space.
Sure, of course. So, okay, so let's imagine that for the sake of this exercise, I'm interested in bathing and water sports. And then in terms of the intervention type, let's say that I'm interested in kind of modifying or maybe I'm modifying an existing space. So I can imagine perhaps I live next to a big surfing beach. So let's imagine that something was being built that affected that space. And I'll click through to the next screen.
Yes, and when you go to the next step, it will ask you to confirm your selection to make sure that somebody who has not made a choice will not be able to go on, because the system is using the information you provide to, and you will see that in the next step, to highlight which type of information is most important given the choices you have made in step 2.
Okay. So there we've got coastal, bathing and water sports and major modification. Okay, great. So what have we got here? Get information and select guidance. So what do we do here?
So in the third step, you will be able to look at the information that the tool provides and you select on what of these risks and benefits you would like to have guidance, and then you can extract that from the document, from the tool. So first, we have been, as stated before, splitting it up into 2 different tracks. The one looks into how to minimize the risks and how to protect human health by interventions and actions on blue spaces. And then we have the other track, which looks into, and you can click on that and then it goes active. We have the benefits, which are divided into the human health and the ecosystem benefits. And depending on what you click, we are now in the benefit section. You can see that there are 3 benefit targets, which look into improving mental health, improving physical health, and then also improving environmental and ecosystems functions.
Sure. And so just to make that clear, sorry to interrupt, if I just click back onto there. So this is for the minimization of risks. Then you can see that these risk targets also get changed. But let's stay with benefits, because that's a nice place to be, I think, for this. Okay, so each of these has a kind of read more.
Yes.
Shall I click on to maybe improve one of these, or?
Yeah, you can just, we can go for one example. If you click on read more on improving mental health, you will get a pop-up window that gives you a short summary on what is meant by improving mental and social well-being, what is covered, and it identifies the different targets, which are nature experience, social cultural interaction, and noise reduction, which belong under that category. So you could get a quick overview of what is covered in that segment, and the same will be for the other risks and benefits.
Okay, so that's then so kind of clear what's in scope for our assessment. And then we go down to this overview. So I've already looked at these, and then it tells me for the overview, basically it has a lot of different categories here. Now these are different benefits, presumably, because I clicked on benefits.
Yes, what you see here are the benefits that are under the 3 different areas identified above. So on the left, you have the mental and social well-being benefits. In the middle, you have the human benefits through active recreation. And on the right, you have 3 benefits that fall under the ecosystem benefit area. So here, you can also go for read more, and you get a more detailed definition, in that case, what water activities include. And it starts with an introduction on the health impact of water activities. And then it has a section on the burden of disease to the extent it can be quantified, and what are the most vulnerable groups. And this will then give you some information to support whether or not you would like to have more guidance information on that benefit. And this will be available for each of the benefits. It provides further information on what this is about, and then you can make your choice whether you think it's relevant or not. And exactly by now clicking on it, if you click on one of those, you will see a selection icon, which means you have now selected shore activities and water activities as the interesting benefits you want to have more guidance information on.
Okay, that I think let's leave it so I can show you. Yeah, I could collect these for lots of different things for the different three benefit targets up here. I want to just stick with maybe two to make it simpler for this run through. So having selected those two of interest, I can click through to the next bit to kind of find my detailed guidance.
Yes, we can do that. And then it will show you that these are the selected ones, and you can see that you only have the green one. So at the moment, we have not identified or selected any risks because they would show up in red. And this is one of the options where you can use at the bottom the arrow back. We can here at this moment go back to the step 3, activate the risk section, and do the same thing here. We have an overview of the 4 risk targets, and then you can read more information on that, and then you go down, and here you have the more detailed risks that relate to the injuries, and then they relate to being in contact with water. And
these exclamation marks indicate that these are things we should be giving some priority to.
Exactly. The exclamation marks will guide the user to those risks, and it's especially about the risks rather than the benefits, where based on your choices in the step before, these are the major risks to be considered. So if we had not made the choice that there is swimming and water sports allowed, the drowning and the injuries in water bodies, as well as the water ingestion and contact, would not be highlighted because they are unlikely to take place, given that nobody is supposed to go into the water.
Sure. Okay. Well, I've selected the ones that I think I'm most interested from I don't surf, but you know, I've tried to have a go at that, and I would be worried about these things in particular, let's say, if I were interested in my local blue space. So I've selected drowning, injuries, water ingestion, temperature, and UV. And I will move to the next step.
It shows you again the benefits you selected.
Benefits, okay. So it's just reminding me that I can look at these as well.
And then you go to the final step 4.
Okay, and now I can see I've got my risks in here included as well. There we go, drowning, injuries, etc. But still down here, I've got these goals related to promoting health.
Yeah, so this is basically the selection you have made in step 3. And here you have 2 options. First, you can read the guidance sheet on each of the risks and benefits that were selected as an online document. So we can just click one open for the example
of these, drowning. Okay.
And here you get what we had seen before, steps 1 and 2, giving a background information on the health impacts of drowning, the disease burden, and the vulnerable groups. But then it continues to a 3rd step where it provides guidance information on what are the elements that can be worked on, what is the way to optimize the prevention of drowning in the blue space. And this is categorized into 3 sections, one on the water body itself and the locational and water conditions. It is looking into user group and behavioral factors, which especially for drowning is very relevant. And then you have at the end in step 3, you have what type of management and maintenance and design factors could be considered to make the blue space more safe and more improved and effective in terms of drowning prevention.
So this is very much about providing a kind of set of factors or issues for decision makers to say, have we considered this? Is this something that we could do to reduce risks or increase potential benefits? Okay, and I see there we've got kind of links to other guidance. So something there from the World Health Organization on how to prevent drowning, and then a list of useful references. Okay, excellent. So that's the first way of doing it. I can look at the individual guidance sheets for drowning, injuries, or the benefit sheets on these different things for improving physical health. And then I guess the second thing is this so-called pooled assessment. Is that right?
The second would be the blue squares on the right, because
Okay,
reading the guidance sheet online, you can also download the guidance sheet. This will provide you exactly the same document, but as
okay.
a PDF document that you can print and download from the system. In terms of information, this is exactly the same. And exactly as you have said before, this is providing background information for urban planners and decision makers to understand why that is an issue, how relevant it is in terms of disease and mortality, and what they can do about it. This is a type of checklist that they want to consider. And of course, the individual solution might look different in different places across Europe and depending on the blue space and its use. But these are kind of information and guidance statements that could be considered and might be relevant for the local situation to make decisions on, or at least to reflect about.
Okay, yeah, so I can see that this would be really useful to print out, and if you're having a discussion with a group of people, then you don't have to keep referring to the online version. You can have these kind of printed out and recorded for reference.
Exactly. And then
okay.
we have the last step with the pooled assessment, because next to printing out the individual risks and benefits fact sheets, we have tried to go for a pooled assessment that brings together into one document all the selected benefits and risks, so you don't have to go out to the field for a field survey or a field assessment trip with individual documents, but it's all put together in one. Of course, now if you open that one, it's going to be a few pages longer because we have a wide range of risks and benefits. And what it does, it reflects the same structure as we had for the individual fact sheets, looking into the water body, and we have by red and green identified which are the benefits and which are the risks. And then we have the same for the user group and the behavioral factors, and you see the risks and benefit statements you have selected. And then at the end, you have the information on how to establish and maintain safe management and design. And this is where you might want to get active as an urban planner, as a local authority.
Sure.
So this is bringing it all together.
And is this downloadable? Yeah. Okay. So here we go. So I can download that.
You can download it, so you can really take it out to the field. And we recommend that this is maybe a field visit at the blue space in question that is done by environmental health and maybe other divisions of the municipality. This will also offer the feature of using it as a checklist. If you go down, you can see that next to each of the statements, there is a checkbox.
Okay, here, yeah.
You can identify those issues that really are necessary to be worked on as a follow-up. And if you scroll down at the end of the document, you will also have an opportunity to list those that are most important. What are the action needs on the water and location factors? And you can put on site already a little bit of information. What is the problem? What needs to be done by whom? So that you can make all these decisions on site, looking at the local situation and the blue space, rather than doing it next day in the office when maybe some details have been forgotten already.
Okay. Well, I'm impressed. I think this is an extremely useful tool, and it's really nice to see, now that we're coming to the end of this project, to see something that really kind of integrates across so many of the things that we've been looking at in terms of mental health, physical health, and the environment. I mean, that's the end for the run through, I guess. We've got to the end of our pooled report. We've downloaded it. Is there anything else you want to highlight before we finish?
Yes, I would like to highlight one thing that we find very difficult we found very difficult in preparing the tool, and that is the extreme diversity of local sites and blue spaces across Europe. So what we tried with that decision support tool is really to support decision making, but it will always have to be adapted to the local condition. Any public pool or a public beach situation might be different. I would not assume that a public accessible beach in Denmark or France is the same as in Greece or Italy. Lakes might be different, the temperature, the local conditions, the climate. There are so many things that will be different from the risk and the environmental profile, so that that tool makes rather generic statements. It suggests certain risks and how they could be handled. It suggests what type of benefits could be increased and enhanced in what way, but there will always have to be a local assessment of what is applicable to the specific blue space in a specific local context. And therefore, the guidance statements included in that document need a further scrutiny and review and reflection in the local context. So we're trying here to basically provide a checklist of things to be considered and reflected upon, and then making local choices depending on local context. And this is why maybe in some of the statements, they are not going into specific details and actions, because it might simply be the case that they work different in different parts of Europe.
Sure, and so that's also something that I should perhaps emphasize, that this project being funded by the European Union's Horizon 2020 program, specifically for this project, we were always focusing on Europe, right? This was never meant to really be extended beyond that. Even though some elements of the project have looked in countries outside of Europe, I think that the DST is really designed with Europe in mind.
Correct.
Okay, excellent. I don't really have anything else to say, I don't think, except thank you very much for your time, not only in developing this, but in explaining how it works. That's really helpful. I think probably to thank you and your colleagues at the Euro-Mediterranean Centre for Climate Change, so particularly Francesco Palermo and Enrico Scocimaro. And thank you very much.
Yeah, thank you for the opportunity. From the WHO side, I would like to highlight the contributions of Aunt Dina to the development of the tool. And we hope it's going to be useful for researchers, for civil society, for urban planners and decision makers. There might be many different groups benefiting from that tool, and we hope it's going to be useful.
Likewise. Thank you, Matthias.
Thanks, James.